Hey, everybody. Welcome to BFR Tuesday. Why am I so out of the picture here? My name is Ed LaCara, and I'm your host. We do this every Tuesday, trying to educate the world on BFR and its applications and some thoughts around the research and how people are utilizing it to not only rehab, but also to help improve performance and increase bone healing and a whole bunch of different ways. So today I'm going to talk about aerobic capacity training and how I utilize it in the clinic and why BFR is so beneficial, especially with somebody coming off of an injury or if they have are deconditioned, like in your older population, and you can really start to move the needle with their aerobic capacity when you're using BFR in conjunction. So I'm going to, well, the first thing, is there any questions regarding BFR or anything in particular that anybody would like me to touch on before I get to what I was planning on talking about today? Okay. All right, if no questions, then why don't I get right to it? I'm going to share my screen and go to my PowerPoint that I have. Okay. All right. So there's a couple different ways that we can utilize aerobic capacity training with BFR. If you've been following me or you've taken any of my classes around BFR, you know that I love this algorithm that Dr. Lonicki out of University of Mississippi published in 2015. And it's an algorithm of what protocol to use for BFR. So, we first look at, hey, does the individual have any contraindications for BFR? If the answer is no, we ask, is the individual mobile? What do we mean by mobile? Well, they are able to either weight bear, or the joint that we're going to be concentrating on has about 90% of mobility compared to the uninvolved side. If it doesn't, then really we should be spending our time on improving mobility before we go into strengthening. If they are mobile, then can the individual tolerate loads, that should be loads, not modes, of 20 to 40% of 1 rep max? If the answer is yes, then we should ask the question, can they tolerate 60 to 90%? Because that would be high intensity. If the answer is no to either one of those, then what we could do is we could start doing low workload cycling or walking exercise with BFR. I also will utilize this for people prior to training other areas, or if I want to use, if I want to start getting aerobic capacity or maintaining aerobic capacity, because I know that if they're coming out of a cast or they want to get back to activity as soon as they can, we've got to maintain their aerobic capacity the best we can. And so this is a way that we can do it. So we can look at this. Cycling is typically one way that people use BFR. Walking is another way. Like I just have a treadmill in my treatment room, and I'll just put them on there. Or people using the UBE. I also have a UBE, a little handheld guy that I got on Amazon that I use when somebody has a lower extremity injury. So what are we going to choose? What's our goal is to preserve muscle, attenuate disuse atrophy, and by providing a larger stimulus to inhibit myostatin, increase in heart rate and local tissue adaptation to lactate threshold training, and to improve VO2 max. We've got to do it fairly often. You got to do it at least 2 or 3 times per week. You can do it up to 5 or 6 times a week. Your limb occlusion pressure, or how much pressure you're going to use in your cuffs, upper extremity, if you're doing like UBE, you're going to be 40 to 50%. I'm going to recommend using a lower percentage to start because it is really, really hard to maintain heart rate with a UBE. Lower extremity, you're going to be 60 to 80% limb occlusion pressure. I like to get them to about a 15-minute but sometimes they can't. Like sometimes people have had a stroke and they can't walk for that long, or you don't want them on a bike. You're trying to replicate what they want to do. And so I'll even start with just 5 minutes, but it can be adopted with an Ultra G. And so we'll put the cuffs on, put them in the Ultra G. And so that way they're buoyant, and we can start improving their aerobic capacity for time as they're not having to deal with so much gravity. So how do we know how to train them? Well, we get their training zone. And the way that we get their training zone is to find their heart rate reserve. So the best way to do that is find their maximum heart rate. So here's your description, subtract the person's age from 220. So you're going to go 220 minus the age. For example, a 50-year-old person, the estimated maximum age heart rate would be calculated as 220 minus 50 years is equal to 170 beats per minute. Step 2 is find their resting heart rate. And then this is best done when the client has not risen from bed rest. Find the radial pulse, count the amount of beats in 60 seconds. First beat is 0. And then step 3 is take the max heart rate, which was the step 1, subtract resting heart rate, which is step 2, and that's going to give me my heart rate reserve. After I've done that, I'm going to take that heart rate reserve and I'm going to multiply it. We usually start off with 30% heart rate reserve. So I'm going to take that heart rate reserve. I'm going to then multiply that times 0.3. That's my starting intensity. And then I'm going to add their resting heart rate back in, whatever I got from the previous page. So for example, if I have somebody that I want to train at 30% heart rate reserve, and they have a max heart rate of 201, which would mean that they're 19, their resting heart rate is 70 beats per minute. So what that would mean is if I go max heart rate minus resting heart rate, it's going to give me a heart rate reserve of 131. I'm going to multiply 0.3 times that heart rate reserve, and then I'm going to add back in their resting heart rate. That's going to give me a training heart rate of 109 beats per minute. How do I get that on the treadmill? I have them start walking with the cuffs inflated. I increase their elevation to 1. I have them check their heart rate. Like in the clinic, I have 3 different ways. Most people that come in have an Apple Watch. We can do it that way. I also have a heart rate monitor embedded on the treadmill, or I also have a pulse ox that I can use. Any of those are good. If you have a polar heart rate monitor, awesome. But I just gradually keep increasing their speed to they're comfortable, and then I start increasing their incline until I get to that target heart rate. 109 is a very low heart rate. It's not hard to get to. So I just get them to that heart rate that I want to train them at, and then I start at 30%, and then I increase by 5% every week. So that way they get a training effect over time. Once they get to about 65% heart rate reserve, then I will switch them to high intensity, which would be more of a performance-based aerobic capacity training, which I haven't come up with, but I will soon because I'm writing the performance-based, meaning non-injured training programming. Here's some studies that have kind of backed this up, what I'm talking about. So you can take a look. A lot of older people have been studied, younger people, athletic individuals like basketball players, Division I basketball players, rugby players. So there's plenty of research out there to take a look. So I'm going to get out of this. Okay, so I see people using this. A lot of clinics I've noticed have a lot of the hamster wheels up in front of the clinic, and then when people come in, they automatically start with a 10-minute warm-up. So we would use BFR. So that way they're at least getting a training effect, because we know that just straight walking is not enough to stimulate physiological adaptation, especially for only 10 or 15 minutes. So you might as well use it as a training episode. I'll use it in conjunction. So if I have a whole hour with somebody, they might do 20 minutes max with the cuffs on, doing some sort of aerobic capacity. And then I will go to individual training, strength and conditioning, or strength and hypertrophy. Because when I have the cuffs on the lower extremity and they're doing walking, evidence has shown, like Abe's studies have shown, that you get increase in strength and hypertrophy of the lower limb. So that might take care of their lower limb exercise. And then I'm going to just, when they get off the treadmill, then I'm just going to train the upper body if I still have time. If not, then that's going to be my training session with them if I just have like a 30-minute session. So it really depends on what your goals are, how you're trying to utilize it. But primarily we're trying to maintain or improve their VO2 while they're injured or they're deconditioned, and I'm trying to improve their VO2 without having to get their heart rate too high. I will give you a word of caution. If we bump this up too high and you have cuffs on the lower limbs, people will become faint because you're really reducing. I mean, imagine if I have cuffs here and I have cuffs here, all this fluid is not coming back to my heart. So your stroke volume is greatly reduced. In order for us to maintain the same cardiac output, we have to increase our heart rate. And so people will become faint and fatigued if you're not careful, if your pressures are too high, or meaning your limb occlusion pressure, or if you try to exercise them too intensely. So no higher than about 65% of their heart rate reserve is what I recommend, and no more than 20 minutes having the cuffs, having occlusion on the legs or the arms. Okay, any questions regarding aerobic capacity training and BFR? All right, great. Well, if you have any questions, please let me know. I'm going to be doing a webinar next week, my normal webinar on Tuesday, but I'm also going to do a webinar Thursday next week on, what am I doing it on? I'm doing it on shockwave and the effect of on soft tissue. So if anybody's interested in that, you can tune into that. I'll send a link for that registration. And what else? That's about it. I'll be in Dallas teaching BFR live August, I guess that's 24th, I believe, maybe 22nd. It's Saturday at the ATI here. And follow me on this if you haven't already. I put these on my YouTube channel every week after I'm done. Hopefully you get something out of it, and please leave comments so I know what you guys are interested in and what else you'd like to learn. Thanks so much. Have a great day.